thank you all for being here and being a part of this. Today's discussion, as you know, is very crucial as it addresses not only the stigmas and challenges surrounding mental health, but it also addresses the broader systemic issues that contribute to healthcare disparities. It's through discussions like these and conversations like these that we can begin to dismantle the barriers and create more equitable healthcare systems for everyone. So with that being said, we're going to open the floor to questions that anyone might have. Anyone? Any questions? Oh, we have a question over here.
Any questions?
Oh, come on up. Okay, you can stand. Introduce yourself.
I'm Jesse. Okay, I would like to know what feedback does your dumping your issues on your best friend or your loved one have on their mental health? You know what I mean? Oh, I had such a horrible day, and I just need to call you and vent on you. And just let it all go on you. How does that affect the other person?
That's a great question. I believe in boundaries. It's very, very important to establish boundaries. If you're not able to, take on those things that they're dumping on you, there's other ways that you can provide help, resources and things like that. But it's very important that you establish boundaries because sometimes we can't just deal with it. Especially if you're dealing with your own mental health issues, and you probably cannot take on anybody else's mental health issues. It's very important that you let them know, hey, I can't deal with this now, but here's someone that you can possibly talk to, or here's a friend that I know that you can possibly talk to. Because I know that can be very overwhelming, and they're not always available to, take on other people's issues and things like that. So that's a valid question. Was that what you asked me?
Absolutely.
Okay.
Thank you so much.
Great. Thank you.
Thank you for your question. Anyone else? No other questions? No? Okay.
You mentioned that there's the bias that African Americans or people of color are drug seeking. There's also the other side of it that they believe that we're too strong or we're strong and we can bear the pain. Would you like to address that? If that is some of recently not one, dealing with women giving birth and they're not giving the epidural and they're like, oh, you can handle it. There's this stigma that believes that Black people especially can bear the pain. And how do you address that part of it?
Yes, that's a great question. Yeah, there is a stigma regarding pain, not just within. So each race and each ethnicity has a stigma associated with how they manage pain. So now, when it comes to the African American community, we are seen as being stronger. We can bear the pain. We have a heightened pain tolerance. So essentially, oftentimes, pain becomes undertreated. And the other part of the piece is also that it's a little difficult for us to voice our concerns and voice our needs because oftentimes we're being stereotyped as, oh, we're drug seeking. But meanwhile, really, this is just what we want. This is what we need. So it's important for us to understand and also know and be aware of what our intimate needs are when it comes to pain, and also addressing those needs with the physician. The other part of the piece is also having a physician or provider who's of the same color as you. I think that's the biggest part of the piece. That's the elephant in the room. When you have a physician who shares the same values of the same race, same ethnicity, there's not much that needs to be explained when it comes to what you want and what you need, especially as it relates to your healthcare. That's part of the reason why I opened up a practice in this neighborhood, because my goal is to provide service to my people, my community, people of the same color, that they can easily relate to me. So that's the first step, breaking those barriers where communication with people of same color, like-minded, same values, once those barriers are broken, I think the rest of it becomes a lot easier. So essentially, as a Black patient, you're no longer a number, you're an individual. And that's my purpose, that's my goal.
No other questions? Okay. We have one more question. Hi. Okay, over here.
My name's Hope, and in essence, my question is kind of on the lines of how do we break down or lessen the stigma, even in like our own familiar settings? Like sometimes it's hard to bring up conversations around public terms of getting therapies and with a family if they themselves don't believe that there's a problem with themselves. So it's kind of hard to discuss like issues within the family if they don't really want to have a conversation and everything versus wanting to communicate for anxiety.
Well, by being here right now, you're already breaking the stigma. You know, having these type of conversations, you know, it's the start of it. I don't think maybe 10 years ago these conversations were conversations that were being had. So just by everyone being here and actually being open and talking about things like this is already, you know, shattering stigmas and things like that. I can relate to you as well, especially people of different ethnic background, you know, African, Caribbean, and things of that nature. They tend to have a harder time, you know, believing in these mental illnesses. It's harder for them to believe it. A lot of times they also want to push it to religion. You know, they want to take it to church. They want to do things, which I'm not saying is wrong or anything like that, but you still have to address the issue, right? And I think both of those should be handled hand in hand. So educating those people, such as your parents, friends, and things like that, you might not think they're listening, but you know, the more you say it, you know, the more they know, okay, she's like this, you know, I actually want to listen to her. But what I don't think you should do is never, ever keep silent.
Any other questions? Yeah. Mr. Rachel.
I just want to ask, because I realize that most people, they don't seek help because they believe they don't have help. And that is where educating our people is so important. But a forum like this today is an advantage to so many people. As a matter of fact, this hall is supposed to be packed full in such a program like this. So my thing is, if you are sick, you are advised to go and see the doctor. But I see some of my people have a ministry. I talk to them that if you are sick, you can pray, you can do everything, but you have to seek the advice of the professional who asks the God to do something after prayer and meditation. So my question now is, if you have a family member that has like mental health issue, but out of self-denial, because many of them they are in self-denial. You tell them they have it, they say no, I'm so much okay, nothing, I have nothing happening to them. Until you get to a point that they cannot do anymore. what can we do when you have a family member that is in denial, that doesn't want to go to the doctor, that doesn't want to go and seek help? What do we do in a case like that to educate them?
Thank you so much for that question. That's a very tough question. Back to what you were saying earlier, the room should be packed. I agree with you, but I'm also very optimistic. You know, there's always next year. There's always further events coming. So I look forward to that actually happening. Your question that you asked about family members that are not willing to seek help, despite having obvious mental health issues, is something that I actually see a lot. It's tough because at the end of the day, they're still human beings. They're still able to make their own decisions, and you can't really take that away. As Dr. Stanley said earlier, it kind of helps when you have someone that looks like them. So when you have a physician that looks like the patient, I don't think it's so much more so like they're seeking help. It's almost like an interaction. For example, I have a lot of young patients that come to me and tell me things that they will never tell anybody else. Maybe they see that I'm a younger physician, but I don't think we should ever lose hope. Maybe introducing them to certain things, such as people that look like them, or maybe they should hear from someone else. Because even when I was younger, my father would tell me certain things, and I'm like, what is this old guy talking about? He doesn't know what he's talking about. But then when someone that was maybe closer to my age would tell me the same thing, I'm like, oh my God, I'm gonna listen to this. So maybe, having different revenues of information being provided to that family member could be helpful. Maybe also, it's important not to also shame them. You can't, just tell somebody, go see a doctor, do this and do this. Sometimes it can get overwhelming. We have to be very patient with these people. Hopefully by them looking at you, they might, see some sense in you and believe, okay, well, maybe my father's saying there's something wrong with me. Maybe I should go get checked out by someone that looks like me, or maybe a friend or something like that. Again, you don't always have to go to a physician, but especially for mental health, it can even start as a friend, just a friend that they listen to could tell them, hey, listen, I've noticed this, is this real? Is this what's going on? How can I help you? And things like that. So to answer your question directly, it's very tough, but you have to be patient and try to introduce them to people that are very similar to them, the same background and upbringing, things like that. Like that.
To how do we get more doctors that look like us? How do we reach the young people? Is anybody doing anything with the young people, getting them interested in treating us and being, just a thought.
So the question is, how do we get more African American doctors to provide service in our community? So I grew up in St. Albans, Adelaide Park. So I grew up in this community. After college, medical school, residency, fellowship, I came back to the community to provide service to the community that I grew up in. So how do we get young Black adults? It's difficult, but part of the thing that I've done on my part is, so on and off, I have interns that would rotate, volunteers that rotate in my practice, which is about a block away from here. So I've sponsored altogether about 6 interns over the past 2 years. So every summer, they spend some time, they work with me, I do a little bit of teaching as well. And I also even have a couple of interns that are in the pipeline that want to start sometime after college, somewhere in mid-July, August. And having them attend events like this, it's something that would actually also motivate them to want to come back to the community and provide service. So this is just a stepping stone. There's a saying that when you come together in numbers and volume, you create a greater impact. So the purpose of this is to obtain that, what the question you asked. So that's my goal, doing more of these events, community service, outreach, mentorship. I also do mentorship at the schools. The school right around the corner, I'll go in, I would spend some time with the elementary school students and also the middle school students. We'll do some exercises. And part of the goal is to also let them know that, hey, what the media shows you as a representation of African Americans, it's not the full story. You could be whatever you want to be, whether it's a lawyer, a doctor, whatever you want to be, and just aspire to be the best at what you do. So that's my.
I have to jump in on that question because that's a question that is very dear to my heart. I've been asking for years. So I grew up in the same neighborhood. As a matter of fact, I actually went to junior high school 8. I don't know if the name of the school has changed. I lived in South Jamaica, and I once attended an event in South Jamaica with young people like myself. I was probably a teenager then. And we had a guest speaker, and that guest speaker encouraged all of us that we could be whatever we wanted to be, but the list was short. She looked at all of us youngsters and she said, you could be a basketball player, you could be an actress, an actor, you could be a baseball player. She never once in that list said, you could be an attorney, you could be a doctor, you could be an engineer. That was not on the list because she couldn't see beyond what she knew. So that's what she expected from the rest of us. And we have a lot of brilliant children. Stanley just told you that he read to some students. He does that often. And it was very sad months ago when he told me, I asked these children what they wanted to be. And one of them said, my mom works 3 jobs. She doesn't even have time to read with me. So that goes back to our social economic values and where we are. So you are as big as your dreams are. When you dream small, you accomplish little things. So I think we're doing a lot of our children a disservice. So how do we get more doctors, more young people to be physicians? By telling them that they can be more than the society is telling them that they can achieve. And sadly, what keeps us down is not even other people who don't look like us. It's us. Because we're not dreaming big enough. So how do we get more doctors? We tell those children while they are young that they can be doctors. It's not going to be an easy road and you probably have to put in 10 times the effort. Not because you're 10 times less smart than the other person, but because for you to be seen and recognized, you really just have to work harder than others, and that's the reality. And I think once we do that and doing programs like this, we can encourage more young people to achieve higher. So thank you so much for that question because it moved me a lot.
Thank you.
Are there any other questions? Okay.
I would just like to say, thank you for this event. This is a great resource for this community. And thank you for having a practice back in this community. It's great to see someone who looks like us practice here. You should accept my insurance.
Thank you so much. Once again, ladies and gentlemen, I want to thank you for coming out tonight and being a part of this event. Oh, we do have a minute.
Yeah, I have a question. For people that are here or even outside of this place that may be using the public hospital system and they want their services to be provided by an African American, are there processes in place or steps that they can take in the hospital to be able to tell them, hey, I want to see a black physician? Is that even allowed? Because I know sometimes, old people, they go to the hospital, they want to see a black doctor, but they can't say, is there any process that allows them to do that?
There's actually none. I think the closest thing they could do is go on. I don't want to advertise ZocDoc, but if you go on ZocDoc, you can actually pick and choose the physician, the provider's race, and ethnicity and languages that they speak to your preference, and then it tells you which provider is suitable for you. Now, it's funny because prior to me opening my practice, I did a quick run through. Even now and then, I'll go on ZocDoc and I'll have my profile, and I'm looking for a pain management doctor within a 5-mile radius who looks like me, or even a 10-mile radius who looks like me, and there's none. So, and that's part of the reason why I said, you know what, there is a need, and there's actually better outcomes when your provider, your doctor looks like you, or at least have some sort of understanding as to your struggles, what you're facing, and your true values. I hope that answers your question.
No, thank you.
You're welcome.
Okay, so is there any other questions? No? Okay, so thank you again for coming out. Before you do leave, right over here to my right, we do have food, drinks that you can take, eat, mingle. But before you go, Mr. Gerald Ikezi, right over here, he does have a gift card for you for coming out tonight to say thank you. Thank you. Have a good night, ladies and gentlemen.
Let's just real quick give it up to Dr. Ikezi, my little brother, for putting this together. I gotta say, he shocked me. When he told me there was an event going on at my hall, I never could imagine in a million years he was putting something like this together with a bunch of professionals to come out and give us, consult us. Because the last time I called my doctor about mental health issues, and I'll say it right now, I was stressed, I got a $1,000 bill. And sitting here, I've got more information from these speakers than I got from my doctor. So Stanley, I want to thank you, and all of the speakers that have spoken here, I thank you guys so much. And quite frankly, this is Juneteenth month, so I'm going to say it straight up, level the playing field, and black and brown people will do better every single time. Yeah, I said it. Level the playing field, and we're the best, hands down. All right, but they're not going to do that, but that's something different. Well, my name is Henry Ikezi, and I'm Stanley's oldest brother, and I sit here right now and tell you straight up, I am truly inspired by what Stanley's doing, and in fact, we need more of this. And you talk about you want to see more black, brown people from our communities as doctors. This is exactly how you do it. You raise You have doctors like Stanley come out here and speak and inspire young kids from the community to do the same thing. And as a father, I'll tell you right now, I'm sure my mom is sitting here wondering, oh my God, I cannot believe I did this. All right, these are my kids that were running around being crazy and all that stuff, and now they are giving inspiration to others to aspire to live a healthier, longer, prosperous life. So let's give it up to all the mothers out there. It wasn't too long ago that Stanley, Gerald, and I shared one bed in a one-bedroom apartment in an attic. And I sit here right now and I'm looking at these guys like, oh my God, this one's a doctor, this one's a therapist, this one's this. We need more of it. We need more successful black men in our community. Those days are gone where our guys and our brothers and sisters are suppressed, oppressed, put in prison for whatever reason. We got to stand up and let them know we can do better. And Stanley, I thank you. I'm inspired, and I'm going to go to med school. So we got food to the right. And by the way, I got to plug myself a little bit because I can't sit here and let Stanley just do all this amazing thing he just did and not say what also truly inspires me. So a few months ago, I decided that enough is enough. I'm tired of seeing my community suffer. I'm tired of seeing the oppression in this community that has given me everything I have and given my mother and brothers and sisters everything they have, and I need to stand up. And I announced my run for office as Queensborough president earlier this year. So please, we gotta support each other. We got to support our doctors, we got to support our brothers and sisters, we got to support our parents. And this move I'm making, running for office, is to support and uplift my community. So the young ones that are coming behind me, they can see that they too can do it. If I can be the borough president of this borough, you can be the president of this great nation. And that's what this whole thing is about. We got to uplift each other and keep rising every single day. So if you want to support the movement, you go to voteike.com where you can donate, volunteer, and support us in any which way you can. And I'll be remiss if I don't give credit to all of the men and women that support my campaign, that work for the campaign, that make it possible for guys like me to run for office when the odds are totally against me. George over there, my mother, my brothers and sisters, Zeron, Nate, and everyone that supports the campaign, thank you. And more importantly, thank all of you. Because it's because of your belief, your grace, your support, that I'm going to win that office, and I'm going to let them know we too can do it, and we can do it better. Just level the playing field. Thank you guys so much. Now let's get some food, man. It's getting past my bedtime.